The first most common breastfeeding concern that moms have usually occurs around about day 3 or 4, often when they get home and their breasts are starting to feel quite hard. And when they feel hard, they're sometimes a bit warm to touch, very, very hard to latch the baby, because when the breast is hard, the nipple's a little bit flatter. The baby can't get such a good grip. This is called engorgement. It's so common. It's to do with all that fluid, the hormone shift, the milk coming in, and it can be quite alarming. First of all, we need to make sure that the breast is drained well. So if baby can latch, that's great. Then that is the first thing that you would try and do, is get the baby onto the breast to drain it. Secondly, to soothe the breast, and it is in fact research-based, you can get some cabbage leaves, the large cabbage, and keep it in the fridge so it's really cool. You put the large leaves around the breast, not on the nipple, and you would change them perhaps after half an hour or an hour. And there's a substance in the cabbage that helps to alleviate that pressure and the pain, and of course the swelling, and help to decrease and help the milk to flow. You can also hand express. We do like the moms to practice that beforehand, so that would be very beneficial for you to do. And reverse pressure softening is a technique whereby we can help to move some of that fluid back into the spaces or lymph, just so it can be absorbed. So we do want to try and make the nipple softer and more protruded so the baby can latch. Reverse pressure softening is a technique that you can Google. It's got very, very particular steps on how to do it. And then for some women, it does help to have a little bit of warmth before the feed, just to help the milk to flow. So not a hot cloth, just perhaps a warm bean bag. That would definitely help. And if it's very, very painful, you could chat to your doctor and perhaps take some ibuprofen, as long as you're not allergic, and that is safe to take while breastfeeding. Definitely, as long as you can keep your supply going. So the crucial aspect is that you've got the milk, that when the baby comes to the breast, it's able to get milk. If you are not stimulating your supply, you won't be making any milk. The more baby takes, the more you make. The more empty the breast, the more milk you have. So there's this big misconception that if your breasts are hard and full all the time, that this is a great thing. In actual fact, a very full breast sends a message to the brain that not to make milk, and there's a feedback inhibitor hormone response that says, we don't need milk. So the more the baby drains the breast, the more milk you'll make, the more you'll have. So to feed little and often is much better than going long periods between feeds. Mastitis is a very painful condition. It's also pretty obvious when a mom has it. The signs would be a very red breast, often hard, painful, definitely, and one would have a temperature. So the treatment for mastitis is to continue breastfeeding and drain that breast as effectively as possible, preferably using the baby, which is always more efficient and effective at taking the milk out than a breast pump. We do say to the moms that a temperature that's above 38 degrees for more than 24 hours may warrant a trip to the doctor and an antibiotic. We like to give it 24 hours to settle, because research has shown that mastitis very often, when it's caught early, can settle beautifully on its own without the intervention of antibiotics. Moms need to know that should they come down with flu-like symptoms, such as a temperature over 38, achy body, a hard, sore breast and redness around the breast, that they immediately go to bed, rest, seek help from people to come in and make sure that they're drinking and eating well. They can take ibuprofen if it's been prescribed by the doctor, or paracetamol is also safe. We prefer the anti-inflammatory effect of the ibuprofen to help. It tends to be more effective. We would recommend that the mom feed the baby on the affected side, and if it's too painful, first on the other side and then offer the affected side. But to make absolutely certain, it really is crucial to drain that breast, because if the mastitis is left and the breast is not drained well, we run the very real risk of it developing into an abscess. Abscess is very often the mother would pick it up as a hard area on the breast, distinctly hard when she palpates, very red, sometimes raised, definitely extremely painful, and that breast may not be draining breast milk well at all. It could be a little bit or none at all. Usually a breast abscess we can prevent if the mastitis or if there's a blocked duct and it's treated in time. So a mom who's experiencing any situation where the milk is not flowing well, or the breast is sore, red, hard, or has a temperature, needs to seek help immediately that day. The abscess is an accumulation of pus, so it's a blockage, it's a bacterial, usually a bacterial infection, and that area very often would need to be drained. So if it doesn't resolve from regular feeding and antibiotics, and the course of antibiotics for mastitis is in fact 10 days, not 5. So very often the moms are given too short a course for it to be effective. If you have mastitis and the doctor gives you a script, it should be 10 days antibiotics. Absolutely. Must breastfeed. Do not stop the breastfeeding. If it's way too painful to put the baby on, you could express, and we do find that heat often helps to get the milk flowing nicely, and sometimes cool packs afterwards just for the pain. But we definitely don't want the moms to leave that breast because it can then develop into an abscess. So the abscess would need to be drained. New research is quite clear that ultrasound guided drainage can be done by interventional radiologists in the rooms where they would put in a needle, look at the ultrasound and see where it is and drain that area. Most of the time, there isn't necessarily that facility available. Then you would perhaps be referred to a surgeon. Please make certain that you see a breastfeeding friendly surgeon or a breast specialist surgeon. It does make a big difference. The surgeon who's used to dealing with breasts would try and preserve the breastfeeding relationship. They would make sure that the dressing is not over the nipple. They would use a technique that doesn't damage the nipple or that would still allow the baby to feed. So it is important that if you have a breast abscess, that you're seen by the correct people, and rather sooner than later. First port of call would be a lactation specialist. So if you're in the early signs and you're not feeling so well, your breast is a bit red and hard and sore, and you're concerned and worried, the best person would be an IBCLC internationally board certified lactation consultant. If you have a midwife that you're close to, you could also speak to them, or if there's a baby clinic nearby, but you need to get help on that day. And a breastfeeding specialist is better able to assist because they're trained to help you to continue breastfeeding and ways of coping, and they would give you a care plan so that you can continue. Thrush is very common, but it's also very commonly misdiagnosed. So if you do think that you have thrush, the first thing that you need to do is make sure that you consult with a lactation specialist to rule out any other conditions of the nipple. You need to make sure your latch is corrected. One of the reasons that moms get thrush is the latch is not right. Secondly, you need to be sure that any bras that you're using are washed at a high heat. That's the only way to kill. It's a very, very, very strong organism, the Candida albicans. You would need to get treatment, usually in the form of a cream for the nipples, and then you'd need to treat your baby's mouth as well. There's no point, if the baby has thrush in the mouth, treating the nipples and then it comes back through not treating the baby adequately. You'd need to see your doctor to get a script for the cream. You'd also need to make sure that any breast pads that you're using are changed regularly, that you don't have that constant wetness. One of the reasons that women get thrush on their nipples is the breast pads are always wet. So it's that constant dampness is a wonderful environment for thrush to thrive. Another reason is that if the mom already has thrush and the baby is born vaginally, or perhaps antibiotics involved, it can make you more susceptible, and the baby has thrush in the mouth, even from dummies not being washed well, or bottled teats, we need to really boil them very, very well to kill thrush. Then you would first expect that the treatment for thrush is going to be anything from 7 to 14 days. It may be 14 days and longer. So don't go for any quick fix treatment that is 2 or 3 days or 5 days. It very often, when you start feeling better, continue another 7 days. The creams that you need to treat thrush, well, they vary. Most of them would need to be bought on script. There are some people who absolutely swear by Gent and Violet. There are some concerns over the use of Gent and Violet around it not being safe to use, but I think speak to your pharmacist or doctor and just get the best treatment quickly. And how will you know you have thrush? Well, we know that nipples that are very shiny and pink, sometimes with little white patches, very often is thrush. In your baby's mouth, when baby opens the mouth, have a look inside with a light, and if there's little white plaque-like formations, particularly on the gums, on the ridge, on the inside here, and on the side of the mouth, and if you try and scrape them off and it bleeds and they don't come off, that's very often definitely thrush. So first get a diagnosis, treat mom and baby, make sure everything's cleaned really, really well, and continue your treatment for the full 14 days. And don't stop breastfeeding. The first main reason for sore nipples is almost always, not always, but almost always a bad latch. The baby is on very shallow and is actually got the nipple resting and gumming on the nipple. A mom who's breastfeeding well should not be in pain. So if you are feeding your baby and you're in pain, you need to relook at the latch. Baby's mouth needs to be wide open, first of all. You need to have baby really close, that there's no gap between your tummy and baby's tummy. When you put your baby to the breast and you're looking down, you really want to see that mouth open wide. You can always put your nipple on the upper lip of the baby to help the baby to open. And it's almost literally very quick, that 1 second that you can get the baby on, and as much as the areola in the baby's mouth as possible, particularly the bottom part of the areola. We don't want babies on the end of the nipples, so a shallow latch is a very common reason for sore nipples. Wrong positioning, where the baby's far away and trying to get to the nipple and can't quite reach it and just grabs however it can, is also another reason for damaged nipples. A reason that's becoming more and more common is tongue tie, where the baby's tongue is not working well. You really need a well-working tongue, and it can't draw the nipple to the back with a soft palate to compress the ducts, which are not on the nipple, they are behind it. So for a baby to breastfeed well, they need to get as much of the areola into the mouth as possible, and they need to be latched well. Another reason for sore nipples would be moms who have underlying skin conditions, maybe more prone to sore nipples. So you're very light-skinned, moms with eczema. You could also get a contact dermatitis where the baby's constantly on the nipple and there's sort of a friction. You can also have where babies have started solids, their saliva has got that food particles in the mouth, which is why we say it's good to rinse our baby's mouth. It's good to do oral hygiene care on babies, because that can also exacerbate and irritate the skin of the nipple. Sore nipples can also be caused by using the wrong creams that may have a reaction, so a kind of allergic reaction to something that the moms put on. And some moms are sensitive to ingredients, so just to be aware. And the lanolin is the only pure ingredient, so if you are quite sensitive, that would probably be the safer option, or to use none. We really want baby at all times to be close. So if you are holding your baby and your baby's head is squashed into the breast, particularly the nose, you would know instantly that that's the incorrect latch. When it comes to breastfeeding, you should always be able to look down and see that the baby's nose is free and that the chin is touching the breast and that the lips are wide open. So really, really important, first of all, that you're in a comfortable position. If you have a chair at home that's got armrests or that you can sit upright in, it would help you hugely to first be comfortable before you start. Then when you position your baby, you want your baby to be as close as possible, minimal space between the baby's tummy and yours. And you want to be able to look down and see when they open their mouth wide, it's almost an up and on. You should never have to force your baby on or press the baby's head. It really should be a natural process of putting baby onto the breast. When you look down and the baby is latched, I have mentioned that the nose should be away as much as the areola in the mouth as possible, as wide open gape, and you'd like to see the lips, so you actually want to see them. And if you can't, you can always take your finger and just gently pull on the bottom chin or just gently pull the bottom lip so that it's flanged, fully open. You then would hope to see the baby swallowing. The baby swallow up to 0.6 mils a swallow. So you've got that suck pause swallowing taking place, and you really would like to see that they're swallowing. Then you would know the baby's getting milk. So the baby can be on an hour with no swallowing, and it's not a good feed. They can be on 10 minutes, swallowing beautifully, and you can actually hear that. When you hear that sound, then you know the baby is drinking. In the early days, the mom may find that once she's put her baby onto the breast, it's a little bit painful the first 5 to 10 seconds. Really just getting used to it. You're not really used to someone being on your breast for that period of time. So if you count to 10 seconds and the pain's still there, you may need to adjust the latch or seek help. Take your finger and just gently pull on the bottom lip so that it's out. So you really want to flange that bottom lip so you can see it. And that is important, because if that bottom lip, if the mouth's wide open, they'll have more nipple in the mouth than if it closed. So you're aiming for looking down, and you can see the chins resting against the breast, and they're all born with these lovely receding chins. So they're actually born and built to breastfeed. It's a completely normal thing for them to do. And that sucking reflex is very strong in the beginning. Sometimes you have to do very little, but just put the baby in place, and it will take the breast, no problem. In actual fact, babies who are born via natural birth can do this wonderful breast crawl. And that is where the baby, in actual fact, finds the breast and nipple themselves. So if they're left on the tummy without any intervention, they will crawl, and they can see where they're going and latch. So that's also wonderful to know that if the process is not interrupted, it can occur naturally. And I think when you are getting help from people in hospital, I would advise you not to let them put the baby on. Rather say to the staff that are helping you, would you mind if I tried myself? And that way, you are empowering yourself and you are finding out what to do. So when you get home, you know how to do it. And make sure that you are aware how to put your baby on yourself. What I would suggest, because they can suck really, really strong, so you don't want to just take them off, because they'll take the nipple with them. And just one latch like that can damage the nipple hugely. I would suggest that you gently take your finger, preferably a clean finger, and with a short nail, and you just pop it into the corner of the baby's mouth and just lift so that you break the suction, and then bring the baby gently away. You really want to break the suction first, otherwise damage can be done. In summary, if you are experiencing problems with breastfeeding, there is always help available. Don't ever give up just because it hurts or you think you don't have milk. There are so many ways that we can prevent breastfeeding problems, and there are so many things that we can do to help you if you are struggling. Nobody needs to struggle with breastfeeding. Painful latch, so much help. Please, please speak to a lactation specialist. If for some reason you're one of those moms who are unable to breastfeed, despite trying your best, despite seeing a lactation specialist, and it's just been too difficult for you, please know this. In your baby's eyes, you are the perfect mother for him. You don't have to be perfect. Giving breast milk is just one aspect of being a mom. You can still be a great mom if you can't breastfeed. In actual fact, you already are a great mom. It's those moms that try and try and try again, that go through so many difficulties, and at the end make the decision to do what's best for their baby, that really are champions. So please, please don't feel bad if you can't breastfeed. The most important thing about breastfeeding will be, first of all, to surround yourself with people who are supportive. When it comes to confidently breastfeeding, we know that women who have a supportive partner and who have friends that have breastfed and people who speak highly of breastfeeding tend to go on to breastfeed much easier than those that don't have that. So support. Join a group if you can, a mom's group. There are many organizations that have voluntary help when it comes to breastfeeding, such as the LATCH League. You certainly don't need to prepare, but when you do have your baby, just take it one day at a time and just know that there's always help available if you are struggling.